our broadcast with some breaking news, a serious epidemic spreading throughout our society, diabetes. For our viewers who don't know, diabetes is a disease in which the body fails to regulate the amount of glucose, or sugar, that the body needs to function. Either the pancreas doesn't make enough insulin to control the blood sugar levels in diabetes type 1, or the body can't respond normally to the insulin that's being produced in diabetes type 2. Pregnant ladies can also get something called gestational diabetes, which can happen if they don't regulate their diet during their term. Now Autumn, our body forecaster, will tell you some signs and symptoms to help you detect if you or a loved one has diabetes.
Hello, I'm Autumn Henson reporting live with HBU TV, and here's today's body forecast. As the levels of glucose rises, the body tries to get rid of the excess glucose through the kidneys. Due to the osmotic effect, there will be an extreme chance of excessive thirst and urination. Also, there will be extreme irritability, fatigue, and unusual weight loss and hunger. Those with type 2 diabetes usually are asymptomatic. However, this body forecast still applies. Due to the high levels of glucose, there will be a disturbance in visual acuity. Also, there will be recurring skin infections, bladder infection, and also gum infections. Keep in mind that this advisory will still remain in effect for both type 1 diabetics and type 2 diabetics until you have sought medical attention and treatment. This concludes our body forecast. Thank you. Back to you, Samantha.
Thank you, Autumn. Here we have Dr. Katie Curvo, who's going to tell us a little bit more about diabetes. Thank you for having us over today.
Oh, no problem.
So, Dr. Curvo, can you tell us a bit about the epidemiology of diabetes, like how many people are affected by it and such?
Yeah, sure. Diabetes actually affects 25.8 million people, which is 8.3% of the U.S. population. 18.8 million people are diagnosed, but there's 7 million people that are undiagnosed. So that means there's 7 million people out there who don't even know that they have the disease.
Oh my gosh.
Among the U.S. residents that are age 65 and older, 10.9 million, or 26.9% of those people had diabetes in 2010. So diabetes is the leading cause of kidney failure, of non-traumatic lower limb amputations, and new cases of blindness among adults in the U.S. Diabetes is also the major cause of heart disease and strokes, and it's also the 7th leading cause of death in the U.S. Non-Hispanic blacks have the highest incidence of diabetes at 12.6%, followed by Hispanics at 11.8%, and Asian Americans at 8.4%.
So what about people who don't have diabetes? How does diabetes affect the entire population?
Well, one of the greatest concerns is medical expenses. The total medical costs associated with diabetes in 2007 was $174 billion. The direct medical costs were $116 billion, and indirect costs, which would be disability, it might be work loss or premature mortality, injuries, that was $58 billion. So medical expenses for people with diabetes are more than 2 times higher than those with people that don't have diabetes.
Wow. So what increases the risk of getting diabetes? Is it contagious?
Well, contrary to what people may think, this is not a contagious disease. Risk factors are not as well defined for type 1 diabetes, but autoimmune, genetic, and environmental factors are all involved in developing this type of diabetes. The risk factors for type 2 diabetes are a little bit more well defined, and that would include older age, obesity, family history of diabetes, impaired glucose tolerance, physical inactivity, and then your race and ethnicity also play a part in that.
So how can we prevent ourselves from getting diabetes?
Well, for starters, you can take a look at the risk factors that we've previously discussed. See if there's any of those that you might be able to reduce. Also, lifestyle interventions like losing weight and increasing physical activity, those have been proven to reduce the development of type 2 diabetes. The lifestyle changes are effective in all racial and ethnic groups. So basically, what I would recommend is for you to get 30 minutes of exercise, 5 days a week, and take a look at choosemyplate.gov. And this gives you some great information on portion sizes as well as what kinds of food you should be eating. And it just gives you a good nutritional guide to follow. If you're over the age of 45 and you're overweight, then you should definitely see your physician to be screened for diabetes. And then also if you're younger than 45, overweight, and you have one or more of the risk factors that we've mentioned, then I think you should also see your physician and be screened as well. But I would consult with your healthcare physician if you have any personal needs or concerns regarding diabetes.
Thank you so much for your time, Dr. Curville.
No problem, thank you.
Now back to Autumn, who will be interviewing one of the victims of diabetes.
Thank you, Samantha. Today we are reporting live from Houston's very own diabetic clinic. Here with me I have Sarah Kirkpatrick. Sarah, would you mind telling us about how diabetes is treated?
Not at all. Those with both type 1 and type 2 diabetes can use insulin, although those with type 1 diabetes are what you call insulin dependent. Insulin works by lowering your blood sugar. They come in the form of shots that you can give yourself when your blood glucose gets too high. Then there are some oral diabetes medications that help to control your blood sugar even though it won't cure it. You have to watch what you eat and always eat on time. Foods that are good for people with diabetes includes lots of fruits and vegetables, especially non-starchy vegetables like spinach and carrots, whole grain foods, fried beans, fish, and lean meat, and water, unsweetened tea, coffee, diet drinks instead of regular soda. People with both types of diabetes need to cut down on sugary desserts like cookies and cakes. And portions are just as important as what you eat. To get a good idea of what a healthy portion would be, you can go to choosemyplate.gov. Exercise also helps lower blood sugar, but you have to always remember to bring food with you in case your blood sugar gets too low.
So we all know that there are many dimensions of health. How have these dimensions of health impacted your life with diabetes?
Well, it's definitely impacted every aspect of my life. Physically, I'm always thirsty and hungry, and I'll be right back.
Okay, we'll just take a moment for her to get back.
Whew, sorry, I'm back.
Okay.
What was I saying? Oh, I feel like I have to void all day. Emotionally, this is a very stressful disease. With all the knowledge I need and the high cost of medications and blood glucose monitoring supplies. Intellectually, I have to learn to watch what I eat and monitor my blood glucose. And if I get too stressed, then my blood glucose rises, which just causes me more stress. On a social and cultural level, I know that it's hard for people to access food that could be the healthiest choices. It's so much cheaper and faster to go through drive-thru than to go to the store and buy the healthiest option you can find. And the spiritual dimension is not safe from diabetes. I have a friend with diabetes that wants to fast during certain times of the year, but can't because of her blood glucose.
So how do you deal with all this? Who do you turn to for support?
Well, the American Diabetes Association is a great place to go to for support. They have all sorts of information about diabetes. They even have a free program you can join, and they will send you informational packets and notify you of events that are happening in your area, like the Step Out Walk, which is a walk that fundraises for diabetes research. They even have a discussion board for people with type 1 and type 2 diabetes, and people with not newly diagnosed diabetes, and even for their family members. I can get them spiritual support from church. Diabetes has become so common that it's easy to make friends at church that have the same thing. We support and encourage each other.
Well, thank you for sharing your story with us today. Back to you, Samantha.
To conclude our special broadcast, diabetes can affect many parts of the body and lead to many serious complications. By working together, people with diabetes, their support network, and their healthcare providers can reduce the occurrence of these and other diabetes complications by controlling the level of blood glucose, their blood pressure, and blood lipids, and by receiving other preventative care practices in a timely manner. Thank you. This is Samantha Lee, and I'm signing off for HBU TV. Regulate the amount of glucose or sugar that is necessary for the body to function.
Of visual disturbance and visual acuity. As
Well, that's reassuring. So how can we prevent ourselves from getting diabetes?
Sure, well, for starters, you can take a look at blah, blah, blah. Okay, can you do that?
Includes lots of fruits and vegetables, non-starchy vegetables, especially like spinach and carrots,